Hello, everyone. Today we're going to be talking about the 2013 to 2023 National Aboriginal and Torres Strait Islander Health Plan. Before I start, I'd like to acknowledge our country. I'd like to acknowledge the Darug people of Mulgo. We acknowledge the first Australians as the traditional custodians of this land, whose cultures are among the oldest living in human history. We'd also like to pay respect to the elders of the community and extend our recognition to their descendants. Further, we would like to state our commitment to a process of reconciliation so all Australians can build a positive and more inclusive future. So, to get started, we're going to be looking at the 2013 to 2023 National Aboriginal and Torres Strait Islander Health Plan. We're going to be evaluating the efficacy of the health plan and reflecting and putting it into our personal practice. So, start off the 2013 to 2023 plan, National Aboriginal and Torres Strait Islander Health Plan, is a framework device starting in 2008 in order to improve health outcomes faced by more disadvantaged Aboriginal and Torres Strait Islander populations as part of the Closing the Gap program. It set out to reduce inequity and inequality in life expectancy and also help health status by creating an evidence-based, holistic, accessible, broad-spectrum approach on physical, emotional, and social well-being. They initially wanted to do this through through policy reform, law changes, and also have members of the Aboriginal, Australian, and Torres Strait Islander community take part in their own care. So they set out initially with 12 priorities. That was, they wanted to start off with improving accessibility, and they wanted the care to be appropriate. So they wanted to actually apply in situations that Aboriginal and Torres Strait Islander people of the community can actually benefit. And they wanted to have impact rather than just being short-lived. They also wanted a robust, strong, and vibrant community-controlled health sector. So they didn't want it to be just policies made from top down. They wanted it from bottom up. They also wanted evidence-based practice. So instead of just people coming up with policies and laws, they wanted things to actually be from research or information given by the Aboriginal and Torres Strait community themselves. The care was also supposed to be based on growth. So they wanted growth and development that lays the basis for long, healthy lives, because that's how you improve health outcomes, is actually from the very beginning. They also wanted the care to be free from racism and inequality, because yes, this has to be culturally appropriate because it's a cultural based act. They also wanted, adult health support, care, and resources to manage health and promote long, productive lives, as I said before. And they wanted it to be based on social and emotional well-being and be based on individual and communities making the policy and the control rather than just random politicians or healthcare policymakers making it. Lastly, they want elderly members of the community, the Aboriginal and Torres Strait Islander community, to be able to live active, healthy, long lives and be culturally secure in the later stages of their life. And that all needed to be supported by multi-sector support in housing, education, employment, and other programs to reduce inequality. That was all based on the Closing the Gap program. So, Closing the Gap was based on reducing pretty much every single inequity possible. But mainly, that was actually trying to, on the healthcare side of things, that was trying to reduce the life expectancy within a generation by 2031. so far that hasn't been reached. It's had some improvements in some states, as you'll see up next, but very little. We also wanted to ensure all Indigenous 4-year-olds in remote communities had early access to childhood education by 2013, which also still has yet to be reached. And as we've said, health actually is underpinned by stuff like housing and education. So that needs improvement in order for us to close the gap. We also needed to have the gap for Indigenous students in reading, writing, and numeracy within a decade because, well, more than logical enough. Education is actually very important. Your own health literacy and being able to understand the care being given to you is actually part of valid consent, and also being able to make your own healthcare decisions. And lastly, they want to have the gap in employment outcomes in Indigenous and Torres Strait Islander Australians by 2023, which also has yet to be reached. As you can see on the graph here, this is table CG2R from the National Personnel Data Collection. So that's actually from, it's published by the NSHQC, and let's take a look-see at the next chart. So that's the difference in estimated life expectancy for Aboriginal and Torres Strait Islander children. And if you can take a look there, there's still quite a difference. In some states, it's actually getting worse. So let's just evaluate that for a minute. So the 2013 to 2023 health plan aimed at several closing the gap targets. Most outcomes related with health have been improving, however, have not been on track with the 10-year targets. So, for example, as you've seen in the previous figures, CTG 1A1 from the Australian Bureau of Statistics, it demonstrates an improvement in most Australian states, but have yet to reach criteria, such as good improvement in targets. And the Australian Bureau of Statistics also states that some areas of Australia, like the Northern Territory, have actually regressed in life expectancy. So they've actually gotten worse, comparing Aboriginal and Torres Strait Islanders and other Australians. Birth weight and infant mortality rates are also fairly important. So we were trying to target 91% by 2031, but the set target points between 2013 to 2031 at the very least are yet to be reached at all. We're not reaching the milestones by far. And it's shown in the Australian Institute of Health and Wellbeing in 2020 that New South Wales, the ACT, and the Northern Territory are worsening in comparison, and that the average healthy birth weight and reduction of infant mortality targets for non-Indigenous Australian children are actually at 94%, so that's still a 3% difference, and that's as of this moment. So we're currently at 94%. And on another note, one field where the health plan has actually not been causing much improvement either is in social and emotional well-being. So as of 2013, rates have been increased and have not been on track with self-harm, suicide, and mental health episodes. That being said, that data is limited due to socioeconomic factors, so we can't exactly base that decline on one single demographic. There are many other external factors, including the pandemic that's happened in 2019 to 2021, and that's being said, there's also been other factors such as socioeconomic issues. So we can't exactly take that data completely. All right, so next part, as of 2021 or 2022, revisions have been starting to get put in place. So let's take a look. See, they are apparently targeting education, employment, and housing in order to close the gap. Issues such as inaccessibility, which was a major issue with the previous framework, are now being solved with incentives, increase education, and they are trying to get more tangible goals. So, according to the Australian Department of Health in 2021, they're trying to reach more tangible, specific goals such as deafness, blindness, and preventable disease. So, something that can physically make a difference in the now. And once fully implemented, these improvements to the previous framework will help attempt to close the gap by 2031. So that's a new health plan. So at the moment, that's being revised since it's already 2023. All right, last part, just on my reflection. The 2013 to 2023 Aboriginal, Australian, and Torres Strait Islander Health Plan is, for the most part, sound. It targets major health inequalities by using strategies and policies on a community level, holistically facing each issue. It aims to cut off problems at the source rather than just mitigating a wound. It also aims to use evidence based practice, which is controlled by the consumer, which is pretty good actually, if you consider that a lot of hospital policies and quality health care are actually just made by lawyers and policymakers rather than consumers. So, partnering with them helps provide more concise, targeted solutions as compared to the previous strategies. So, for example, the 1989 to 1997 Aboriginal and Torres Strait Islander Health Plan, where it states, according to ADHW, that many important underlying social and economic issues are not directly addressed in this publication, either because they lack adequate information or because they are beyond its scope. So we've actually been growing since about 30 years ago. That being said, it's not without its own flaws. So, for example, none of the target goals have been reached so far, and in some states it's actually worsened. Accessibility was also pointed out as a major issue, as despite the funding being increased for a lot of services, the access to treatment has actually been lower, according to the Australian Department of Health and Aged Care in 2021. So, for my own nursing practice, I aim to improve the level of health promotion towards my own patients, and I am attempting to develop my own relationships with the Aboriginal and Torres Strait Islander community. So, patient wise, I am actually doing my best to try and promote any sort of benefits or anything that can help their overall health outcomes. I'm also trying to provide more seamless, appropriate, and effective management of chronic diseases in my workplace in order to construct appropriate care planning for patients. So, I'm mainly working on the fifth standard of the registered nurse standards in the NMBA, which is coordinating patient care and constructing appropriate care planning. Lastly, I'm also going to reflect on whether or not the care being provided is making progress because, like I said before, the the health plan has actually shown to be, not making too much progress in some states. So, um, I'm going to actually take a look at my chronic disease patients and whether or not the treatments that we're providing are actually doing anything for them, especially when in some contexts Aboriginal and Torres Strait Islander patients actually get missed because of, well, sometimes they do have an avoidance or lower trust in the healthcare system, which can't exactly, be blamed because it's not as if the healthcare system has been completely based around them, and rather they've been having to shape themselves around it. So I'm going to be working using the seventh standard of nursing practice and NMBA registered nurse standards for practice. So evaluating outcomes to inform nursing practice. Anyways, thank you for listening to my presentation. And that'll be all. Thank you.